Hi, my name's Alex Conway. I'm a fourth-year medical student at Kaiser School of Medicine, and this is Dermatology Questions 1 through 3. Dermatology Question 1. A 20-year-old woman who is an avid jogger and currently training for the LA Marathon presents to the urgent care clinic for sunburn. She developed pain and redness on both her arms after 3 hours of running outside today. She was recently prescribed a topical and an oral medication for acne vulgaris. She has no allergies to any medications or dietary supplements and has no other medical history. Physical examination shows confluent areas of erythema, warmth, and edema on her upper extremities that are tender to the touch. Which of the following is the most appropriate initial treatment for this patient's condition? A. Oral prednisone. B. Supportive care. C. Topical benzoyl peroxide. D. Cephalexin, or E. Topical silver sulfadiazine. The correct answer is B. Supportive care. This patient is suffering from a mild to moderate sunburn and should be treated with supportive care. The patient's sunburn is likely a result of photosensitivity reaction from the use of doxycycline, which causes significant photosensitivity in comparison to retinoids and is one of the treatments of acne vulgaris. Supportive care for mild to moderate sunburn includes cool compresses, aloe vera, calamine lotion, and NSAIDs. Severe sunburn may require hospitalization, wound care, intravenous fluid therapy, and analgesia. The side effects of topical azelaic acid, dapsone, and erythromycin is erythema, dryness, and pruritus. Additionally, these medications are treatment for inflammatory acne. Oral antibiotics, such as the first-generation cephalosporin, cephalexin, or Keflex, are not indicated. Dermatology Question 2. A 16-year-old boy comes to the office complaining of itchiness and rash on his upper back for the last week. He says his girlfriend first noticed the rash on the nape of his neck 7 days ago, which then spread to cover most of his upper back and shoulders. 2 weeks ago, he went on a trip with his family to Indonesia and stayed in a beach resort for 4 days. Past medical history is unremarkable and he does not take any medications. His pulse is 75 beats per minute, respirations are 18 per minute. Blood pressure is 110/75, and his temperature is 37 degrees Celsius, or 98.6 degrees Fahrenheit. Body mass index, BMI, is 25.9. Physical examination shows well-demarcated, hypopigmented macules over the back, chest, and shoulder girdle. Which of the following is the most appropriate test to confirm the diagnosis? A. Lesion scrapings with potassium hydroxide, or KOH. B. Patch testing. C. Skin biopsy. D. Skin culture. Or E. Wood's light examination. The correct answer is A. Lesion scrapings with potassium hydroxide, or KOH. Pityriasis versicolor, also known as tinea versicolor, is caused by Malassezia globosa, a yeast infection that can inhabit the skin and feed on lipids to survive. It is more common in hot, humid climates because the increased sweating creates a suitable environment where the organism can live and thrive. Pityriasis versicolor often presents as pruritic, hypopigmented macules along the areas rich in sebaceous glands, such as the trunk, neck, and arms. To confirm the diagnosis, lesion scraping with potassium hydroxide KOH preparation can be done, and it will reveal hyphae and spores resembling a spaghetti and meatballs appearance. Treatment may be achieved with topical selenium sulfide. Answer choice B, patch testing, is incorrect. Patch testing can be helpful in patients with allergic contact dermatitis. It can aid in identifying offending allergens and allow patients to avoid them. However, this patient's history makes allergic dermatitis unlikely. Answer choice C, skin biopsy, is incorrect. Biopsy is often done for the diagnosis of skin malignancy and vitiligo and in areas of diagnostic uncertainty. The patient's clinical history and characteristic skin lesions both point towards pityriasis versicolor, so performing a skin biopsy is unwarranted. Answer choice D, skin culture, is incorrect. Skin culture can be done to confirm bacterial and fungal skin infections. However, because results take longer to obtain and could delay treatment, more rapid tests such as lesion scrapings with potassium hydroxide are preferred over cultures. Answer choice E, Wood's light examination, is incorrect. Wood's light exam involves shining an ultraviolet or UV light against the skin. The area infected with the organism will emit a yellow-orange fluorescence. However, this finding can only be found in 50% of cases, and thus is not an appropriate confirmatory test. Key learning point. Malassezia globosa is the causative agent of pityriasis versicolor. It is most common in hot, humid areas. It often presents as well-demarcated pruritic hypopigmented macules around the torso and arms. Confirmatory diagnosis is done by microscopic examination of skin scrapings with KOH preparation.
This episode is brought to you by Netflix. So Netflix is basically Santa this year. 2 NFL games on Christmas Day, streaming live. At 1 p.m. Eastern, it's Cowboys, Commanders. Then at 4:30, you've got Lions, Vikings. Midwest football, playoff stakes, and probably some snow. Watching holiday football is a tradition the whole family can enjoy. Open some gifts, grab some food, settle in, and watch NFL Live on Netflix this Christmas Day.
Dermatology question 3. A 62-year-old man is brought to the emergency department by helicopter 75 minutes after sustaining burns over 35 to 45% of his total body surface area in a warehouse fire. The paramedics report that the patient was trying to protect his coworkers from an isopropyl alcohol fire that took place at an auto parts warehouse. His pulse is 108 beats per minute, respirations are 26 per minute, and blood pressure is 148/78. The areas of burned skin are covered in a black and brown eschar, and the dermal layer is visible in some areas. Over the next 24 hours, which of the following is the first priority in management? A. Administration of tetanus toxoid. B. Broad-spectrum antibiotic therapy. C. Excision and grafting. D. Hyperbaric oxygen therapy. Or E. Intravenous fluid resuscitation. The correct answer is E. Intravenous fluid resuscitation. Immediate intravenous fluid resuscitation is the most crucial intervention for managing an adult patient with severe full-thickness burns involving more than 20% of the total body surface area, or TBSA. Significant burns can cause various complications, including compartment syndrome due to circumferential eschar formation, acute kidney injury, coagulopathies, and infections. However, the immediate priority within the first 24 hours is to replace the substantial fluid losses that occur immediately after a severe burn. The Parkland formula is commonly used to estimate fluid needs, which is based on the patient's weight in kilograms and the percentage of TBSA that has been burned. According to this formula, 50% of the total fluid requirement is administered within the first 8 hours post-burn, with the remaining 50% given over the next 16 hours. Ongoing fluid resuscitation beyond the first 24 hours should be adjusted based on urine output, with a target of 0.5 to 1 milliliters per kilogram per hour. Subsequent management should include temporary wound coverage, nutritional support, pain management, and prevention and management of complications such as compartment syndrome and infections. Answer choice A, administration of tetanus toxoid vaccine, is incorrect. Tetanus toxoid administration is important for burn patients with non-superficial burns who need their tetanus vaccine status updated, but it is less critical than immediate fluid resuscitation in severely burned patients. Answer choice B, broad-spectrum antibiotic therapy, is incorrect. Prophylactic broad-spectrum antibiotics are not recommended for severe burn patients. Although many of these patients may develop infections during their treatment and recovery, using broad-spectrum antibiotics without confirmed or suspected infection does not improve outcomes. Answer choice C, excision and grafting, is incorrect. Excision and grafting may be performed within the first 24 to 72 hours using various techniques, but are not part of the initial priority in patients with severe burns. Answer choice D, hyperbaric oxygen therapy, is incorrect. Hyperbaric oxygen therapy has not been shown to improve outcomes in acute burn management, although it may be used later for compromised skin grafts. Its primary use is in treating carbon monoxide poisoning and decompression sickness. Key learning point. Severe burns result in significant fluid loss, potentially leading to multi-organ dysfunction or death if not aggressively managed within the first 24 hours. The Parkland formula, calculated using the total body surface area, TBSA, and the patient weight, is frequently employed to estimate fluid requirements in the first 24 hours.